Andrew Knox is a leukemia survivor and the victim of one of South Australia's most shocking medical scandals.
My life is completely bound up with medical appointments. I've had 16 significant operations and procedures since the bungle, and more to come, I think.
Mr. Knox believes his life today would have been very different if not for a terrible error that was made 10 years ago.
Because I didn't have any mutations, the evidence was I ought to have been cured.
The 75-year-old was one of 10 patients given only a single daily dose of a chemotherapy drug when they should have been given 2.
The result of that was that all were doomed to relapse.
The chemo bungle was discovered at the Royal Adelaide Hospital in mid-January 2015, but Mr. Knox continued to be underdosed at the Flinders Medical Centre.
They issued about 40 emails saying that they were changing the protocol, and according to the evidence before the coroner, nobody read those protocols.
The deaths of Joanna Pinksteren, Christopher McRae, Carol Bairnsfather and Bronte Hyam following their underdosing sparked a coronial inquest which began in 2017. Just before it began, Andrew Knox underwent a stem cell transplant to save his life. And after 2 years of evidence, the Deputy Coroner Anthony Chappell found the error was the result of woefully inept clinical governance. He said the process was sloppy and prone to introduce error, and that using email was an inappropriate and clumsy way to tell staff important information.
The FMC and RAH were behaving as cowboys when lives were at risk.
The Deputy Coroner also slammed SA Health's incident reporting system known as the Safety Learning System. He recommended it be replaced with one that reports adverse events immediately. 5 years on, that hasn't happened.
It's just crashing. I'm sorry. I'm not Lord. I just don't understand it.
In 2019, SA Health commissioned a review which found its safety learning system was sufficiently flexible to deliver the changes recommended by the Deputy Coroner. But that review also found that clinicians often received a lack of feedback after raising concerns, causing them to become disengaged and frustrated with the system. The Doctors' Union's Bernadette Mulholland says those issues still exist.
There's that lack of confidence that in submitting a safety event or a safety issue, that nothing gets done.
In a statement, SA Health told the ABC that it's preparing a tender process to consider a replacement of the SLS as part of its ongoing review of IT systems, and says all of the remaining recommendations have been addressed, including the rollout of a statewide prescribing system due to be completed early next year.
It's really important that we have something that's functional, that's timely, that they can fill out with some ease, that's user-friendly, and everyone can use it, and there's a resolution.
The fact that people are continually affected, hurt and injured after events are known or first reported is just totally unacceptable.
Mr. Knox says he'll continue to be a voice for all patients within the health system.
The only thing that keeps them going is the hope that what I've gone through can make it better for other people, and I'm just being ignored.
Bethany Alderson, ABC News.